So let's start our program this evening by talking about the issue that's kind of been in the news the last day or so. That's what I gather from the newspaper accounts, the resolution of the health premium issues relative at least to the most immediate controversy. Let's start with you, Senator Senjum. Maybe you can bring us up to date on this, and we'll kind of go around the table here and get everybody caught up on this. So tell our viewers what's happened on that.
The subject's health insurance, and we today actually passed off the Senate floor the conference report dealing with, and this is the report that now goes on to the governor with respect to health insurance and how we're going to begin to deal with this issue. I think all of our emails are full and phones are full of messages from constituents for the last seemingly a couple of years on health insurance premiums and what to do about them. So we're starting with a rebate. There's issues, there are not issues necessarily, but there's solutions related to continuity of care so that if you're under the care of a certain physician at this point in time that you can continue to that and so on and so forth. But it's the start of, I think, of a journey that this is a big mountain to crawl over, so to speak. But I think nothing but positive, I think, what happened in the last couple of days in terms of conference committee and beginning to unfold this a little bit and work towards even grander solutions.
$300 million or a little bit more?
$300 million, yeah. But again, this is not an easy hill to climb. And we'll see how it all goes.
Senator Carlson, I assume this goes to the governor, and I assume he's been involved in these conversations and is likely to sign the bill. I mean,
yes.
You may not speak for him, but you may have some inside information on this.
I don't have any inside information other than he was involved in the negotiations. One of the big things that we were very happy about is that the bill did reflect the governor's discount, a 25% discount, so people don't have to pay up front for their entire premium. It will be 25% discounted, as opposed to the prior offer, which was to give a rebate. And so there's no rebates in this bill. And what you would have had to have done then was to pay up in the beginning, and of course, if you don't pay, you don't get your policy. And then you would apply for a rebate, and it would be means tested to find out whether or not you get a rebate. And the problem is that, of course, with all of the people that we would have to serve, there would have to be a bureaucracy set up to handle these questions and that means testing. So we're very happy that the bill that was passed today did reflect the discount. Some things that we weren't quite so happy about was that it does add in for-profit companies that can come in and sell insurance in Minnesota, which we haven't had before. Now that's something that there'll be quite a time between today and whenever that becomes effective. Mm-hmm. And then the other thing that we didn't like was taking the $300 million that you mentioned out of the reserves. The state reserves are for more emergencies, and especially when we already have a surplus in the forecasted budget, that we would have rather seen that come out of the forecasted budget. Otherwise, I did vote for it.
Representative Erdahl?
Well, a lot of the points have been covered, and we actually passed the bill just before the Senate did. So, but the bill, some things that you have been talking about. 49 other states do have profit companies in insurance. I think we'll be able to adjust to that well. The other things. Well, first, this is a good example of compromise. The governor's mechanism for paying for this, as you said, the discount was established, but also we wanted some what we felt were reforms, and then the for-profits was one. Ending any surprises in billing was another. I think that was important because I've been a victim of that recently. And agriculture co-ops, that farmers have more opportunities for the insurance. I think there are a lot of good things in this, and it is a good example of compromise.
Representative Moran, your thoughts on the health insurance premium bill?
Yeah, well, thank you. So I just want to, from a part of my introduction, I just want to, for the viewers to know that I'm serving my fourth term in the House of Representatives, and I sit on education policy, education finance, I don't know, health and human service reform, and jobs and energy, which is new for me. So I probably bring a different perspective to the table around this whole healthcare conversation. The district that I represent in District 65A, the median income for my district is about $35,000 or so like that, a very diverse community of families. And so when I look at this outcry from, community members, and healthcare is something that we all must have, right? It is just like critical to your health. But when I hear a population of people who, in my district, we're going to the Affordable Care Act, we're getting our coverage from there, or people are working. So these are people who have to go to the individual market, right? Because they make a little bit more than what is available in the Affordable Care Act. So in my community, that would be seen often for, it would be like those rich folks, right, who don't have, they're small business owners who make a certain amount of money, who cannot find coverage, right? And we know that health care has never been affordable. We can remember times when there was individuals who were going bankrupt because they could not afford the medical coverage, right? So there was a time right before the Affordable Care Act where people were using the emergency room for coverage, right? And it was just out of control. So as part of trying to get health care coverage under control, we brought in the Affordable Care Act. And so we at a place where we believe that government has a place in people's lives, right, to help the most vulnerable, to help those who are unable to help themselves, those who fall on hard time. Government is there to help them up and get them back in a place. But here we're now supporting those who are making a little bit more than what we have done in the past, right? And I hear people cry and I understand the need for coverage. And so, so as I looked at the place that we are today at this moment, and I looked at what came out of the House and the Senate, I had a little difficulty trying to support for-profit companies. And I had a problem with that because with all the issues that we're having with insurance companies, who are all nonprofit, that are not in the market, and we look and we say, we don't know how much profit they're making. They're hiding it. They're not giving coverage. But then we add for-profits into this equation when their bottom line is about making a profit. So it's my hope, it is my hope that as we move forward into the reform and other pieces of health care, that we don't forget the cries of the people who are not able to afford, that they have pre-existing conditions, that we can still cover that my children who have gone to college, who have not been able to find a job, but are still able to be covered under my insurance up to the age of 26, that we still have some benefits, that people do not go back to the time where they were so sick that the only doctor that they ever saw was the doctor in the emergency room. So for me, I didn't vote for it.
Okay.